Hi everyone, my name is Schwob-Nelson. In this video, I will be discussing organ donation programs in the U.S. and around the world. The U.S. currently operates with an opt-in donor program. This means an individual must actively register to be an organ donor, attempting to increase annual life-saving transplants. 17 countries around the world have adopted an opt-out donor program, Spain being the world leader in donor rates. With opt-out donor programs, when someone dies, their organs are eligible for transplant through presumed consent. Citizens can still declare their organs ineligible through the same method of registry we use with opt-in donor programs. According to Health Resources and Services Administration, as of 2020, there are 109,000 citizens waiting for organs, and another person is added every 9 minutes. This poses an important question. Should the U.S. follow other countries' lead and move from an opt-in program to an opt-out one? Experts in the medical community are not in agreement to which program works best. One side argues three main points. 1. Opt-out donor programs are a violation of citizens' rights. When Brazil implemented a strict opt-out law in 1997, the law was repealed a year later due to accusations of body snatching. 2. Implementing it would be extremely costly. And 3. Rates of transplantable organs wouldn't dramatically change except in the case of living donors. In some countries, donor rates didn't change at all or actually dropped after the introduction of opt-out programs, Singapore being the prime example. Also, experts argue opt-out donor programs don't solve the continuing problem of consent or authorization for donation. Of the countries that have adopted opt-out donor programs, most of them still allow the family of the deceased the right to choose. On the other side of the argument, experts claim opt-out programs would dramatically increase donor rates. They feel making the move would make all citizens' organs available using presumed consent. This would increase the donor pool because previously ineligible organs and tissue from individuals who never opted in due to inadequate knowledge, deficient mental capacity, or being a minor would now be available for transplant. Arshad et al. Conducted a study to reveal the updated statistics between opt-in and out donor programs. The results were there are no significant difference between the two. Among 35 countries registered with the Organization for Economic Cooperation and Development. The only difference the study revealed was the considerable difference with opt-out programs having a dramatic decline in living kidney and liver transplants. Whether one is a supporter of opt-in or out, both sides can agree on certain factors that would influence annual donation rates. The most important being better education of the public. We need to educate the public to make donation the default. Statistics are even worse when compared to the nation's youth population. In March of 2022, Woltering et al. Conducted a study of 407 young adults. They were asked to complete a questionnaire about their feelings towards organ donation. Only 19% of the sample were registered to donate. Shockingly, 62% of the study's participants had either never heard of registering, had not thought about it, or were undecided. The study identified other factors contributing to low donor rates as well. One factor being racism. Due to institutional racism, doctors are less likely to approach a person of minority about donating. Another factor contributing to low donor rates is the need for funding for specialized equipment and specially trained staff. Once the surgeon removes the organ from the organ is viable for hours. Warm perfusion machines could extend the viability time of harvested organs from hours to days. Considering geographical locations of patients to facilities equipped with these machines, this extended time could save many more lives. To bring this video to conclusion, organ donations save and transform lives. Both sides of experts can agree something needs to change. The public needs better education regarding organ donation. Societal culture around donation needs to change to one of donation as the default. Further funding is needed to equip hospitals with organ-preserving equipment, and institutional racism needs addressing.